Hello. Hi. Thank you, everyone, for being here. I'd like to talk to you today about basically what data and machine learning can do for female health, and also why that's very important. Click syncing. Next slide. Okay. So a little bit about me. So my name is Marija, and then next slide. Next slide. So yeah, in my previous life, I used to be an astrophysicist, and then in a kind of career shift that I'm sure is familiar to many here, I basically moved from academia to data science. Used to work for a couple of years in affiliate marketing, and then for about the last 3 years have been working in health tech, and more specifically femtech, where, just one thing, my clock is not running, just so that. The clock is not running? Okay. Okay, good. And so, sorry, can I go back to the last slide? Yeah, so about the last 3 years I've been working at Clue in health tech or femtech, where I work at the intersection of data science and product and basically research to try to help our users understand their menstrual cycle, and also to help push research in female health forward. Okay, next slide. And so just one very quick slide about Clue. Clue is a menstrual cycle tracking app that delivers personal health insights and personal predictions. And why is that important? Why would you want to track your cycle? Next slide. Next slide. So female hormonal system is amazingly complex. There is 4 sex hormones that basically go up and down throughout the cycle, and that basically affect your daily life. And here, just 2 are shown for simplicity. So after your period, your estrogen goes up and then falls down shortly before ovulation, when progesterone starts to go up, and then both eventually go down at the end of your cycle. And so these hormonal fluctuations basically affect a lot of things about you, how you feel, your energy levels, your emotions, the pain that you may feel. Next slide. And so at certain parts of your cycle, you may sleep better or worse, or you may be calm or anxious or motivated or not motivated, have high sex drive, low sex drive, and so on. And so generally, at the beginning of the cycle, you'll feel good, like your hair and skin will be good, high energy. Then around your fertile window, you'll basically still feel good, be sociable, have high sex drive. Then after ovulation, you'll like your hair and skin will be oily, and then towards the end of the cycle, you're likely to start experiencing symptoms like all sorts of cravings and just generally feeling low energy, potentially sensitive, experiencing pain symptoms, like headache or cramps. And so basically the cycle is kind of generally divided in these 2 phases. The first phase before ovulation called follicular phase, and then the second phase after ovulation called luteal phase. Next slide. And so with Clue, you can basically track all of these things. So all of these things that are relevant for basically how your hormonal cycle influences your daily life. So pain, energy levels, motivation, hair, skin, and so on. Basically 30 plus categories. Next slide. And so why would you actually want to track your cycle? Well, we kind of think of it as basically kind of centering around these 3 main questions. One is, am I typical? Basically to answering the question, is your cycle kind of in its usual rhythm, or is there something off? The second question, am I healthy? Like, can I know when something is really off so I can go see a doctor? And then the third question is basically just understanding these patterns of your cycle that I discussed. And the question is like, what is about to happen? Next slide. And so in the main part of my talk now, I'd actually like to talk about how we use data at Clue to basically answer these 3 questions. Next slide. So just for context, so far we've had more than 2 billion tracking data points tracked, and more than 50 million menstrual cycles tracked. Next slide. And again, like I will basically focus the rest of the talk around these 3 questions and give kind of an example for how, like, what we are doing to help ourselves and our users answer these questions. Next slide. So first question, am I typical? So basically what we'd like to answer here is so for every user to answer, like, how do I compare to my peers, or how do I compare to people who are similar to me in a certain way, or how does this cycle compare to my previous cycles? And so because certain tracking pattern can be kind of normal and typical for one person, but not typical and not normal for another person, we'd basically like to figure out, like, are there groups of kind of segments of a user that are kind of similar within each other that we can then use to basically build these groups of similarity. And so what we've used here is LDA, latent Dirichlet allocation, which is a generative probabilistic model that's traditionally been used to basically infer topics from a corpus of documents. So you basically feed it, for example, a year of articles, like New York Times articles, and then it would basically from that infer that there are topics such as politics and fashion and sports. And in these models, words are the observed variable, and then the latent variable from the L in LDA are basically the distribution of documents over topics and distribution of topics over words. And so in our case, we basically consider users as documents, and then things they track are words, and then the topics that the LDA would come up with would be these user segments. Next slide, please. And so these are just a couple of segments that basically LDA has uncovered. For example, we found that there are these users, these 2 groups that we call glass half full and glass half empty, basically people who mostly track or primarily track positive symptoms. And then they're the ones who primarily track negative symptoms. We've also, the LDA has also surfaced something that we knew existed in the data, for example, pill trackers, people who are on a pill, and so mostly track whether they've taken their pill or missed it or taken it late. And then another interesting kind of category that came up is that there's a fraction of users who actually mainly use Clue to track sex, so protected sex, unprotected sex, high sex drive, and so on. Next slide, please. The second question that we kind of like to answer for users is, am I healthy? So basically, we'd like to be able to detect a pattern that would tell us that someone maybe has developed or is likely to develop a health condition. And so we did a pilot project a while back where we basically try to see, can we detect one of these kind of the most common but notoriously difficult to actually diagnose a reproductive health condition, the polycystic ovaries and endometriosis. And so we looked at our data and tried to see, is there, so for certain people that we knew had these conditions, is there anything in actual data that would tell us something about, like, their cycle characteristic that would tell us if they have a condition or not? And we couldn't find anything that was very predictive in our data. So what we did is basically we sent out this survey where we asked people if they exhibited one of these, I think, 17 most common symptoms having to do with these conditions. And then we built the random forest model that included these symptoms as features, and also included as features things like age and age of first period, and also menstrual cycle characteristics from the app. So those were the features, and then the response variable was basically whether the person has told us that they have already been diagnosed with a condition, or that they have had no diagnosis. And there are a couple of issues and complications with this model, because basically what we'd like to do is we'd like to tell people who have said that they have no diagnosis, we'd like to tell them that they may have one. So basically we're relying on our model to misclassify certain people, basically from no diagnosis into diagnosis category. And the tricky thing here is that you don't actually know if your model is misdiagnosing because these people actually are more likely to have a condition, or because the model is performing poorly. So these kind of noisy and unreliable labels are an issue. And also one big issue is that we don't have a control group, because you can't, for obvious ethical reasons, you can't tell people that you don't suspect are at high risk that they may be at a high risk. And so we've done, like we've tried to estimate kind of like how well we did, and we sent a follow-up survey to people that we informed that they may be at a high risk, and we asked them if they'd seen the doctor and if they've gotten a diagnosis, and kind of, even though those responses are also likely to be biased, we think that the level at which we're able to detect this was higher than if we just randomly kind of told people to go see the doctor. Next slide, please. And so because of those issues, we're now exploring a different approach, where we're basically using Bayesian networks, which are these networks basically describing conditional dependencies between random variables, and dependencies between these variables are described as basically presented as a directed a cyclical graph, and it turns out that they're actually particularly well suited for kind of medical diagnosis, because the dependencies between diseases and symptoms can actually be described as nodes and edges in this graph. And so this model relies on the expert knowledge to basically kind of input these conditional dependencies and probabilities. For example, what is the probability that someone has a condition like PCOS if they have particularly long cycles? And then with all of this knowledge, then the Bayesian network basically surfaces the relevant questions to ask and determine and come up with the most likely diagnosis. Next slide, please. And so the third question that I mentioned, and the third model that I'd like to talk about is basically what is about to happen. So what we also try to do for our users, we basically, based on the data that I've already tracked, we would like to tell them what is likely to happen in their next cycle. So for example, if you track that you're motivated at a particular time in your cycle for, like in your previous cycles, then in the next cycle, we'd like to tell you when that's likely to happen again. And so here we tested a number of different models, but it turned out that basically logistic regression did just as well, or almost just as well, and as some of the more complex ones. And so we basically built the logistic regression models, which had as features basically symptom presence in the previous cycles. We tested a number of other features, like person's age, BMI, even things like day of the week, because people are more likely to be happy on the weekend, or maybe stressed during the week. But we basically found out that the thing that had the most predictive power was basically lagged features, basically symptom presence in previous cycles. So if you were stressed again at a particular part in your cycle, in your previous cycles, you're more likely to be stressed around that same time in this cycle. Next slide, please. Thank you. And so I'd like to spend the last few minutes actually talking briefly about something that's not necessarily state-of-the-art machine learning, but is very important and very kind of near and dear to our hearts in Clue, and that those are our scientific partnerships. Next slide. So we one of the big part of what we do is we partner with scientific institutions and basically make our data available for them to analyze and use in their research. And we did it because really our data set is unprecedented when it comes to basically female health and menstrual health. Supports a variety of kind of study designs, so we do a lot of retrospective studies or kind of prospective studies as well. It's global. We have data on people from, I think, 190 countries, and we found that basically when we look at what people, the data sets that people used to do in the past, we find that our data set is multiple orders of magnitude higher. So with Stanford University, for example, we've partnered to basically try to reproduce the results of a couple of seminal studies in menstrual health research. And we find that, like, for any given age, we have about 100 more people than these previous studies have had total. So it's really remarkable kind of data set. With Columbia University, we've partnered on a prospective study where they use Clue as data collection tool, and they're studying the relationship between the age at which you get your first period and the likelihood of developing breast cancer, because it turns out there are hypotheses that the two are related. With University of Oxford, we've basically sent a survey to all our users because we wanted to study the relationship between STIs and PMS, because there's a hypothesis that basically the PMS symptoms are basically symptoms of an underlying infection, and we find that, for example, physical PMS symptoms can be thought of a sign of an STI, where psychological, not so much. And then lastly, we've also partnered with the Kinsey Institute, where we did a large survey on basically how people use technology for intimacy. And again, we've sent a survey to our users and gotten 140,000 responses back. And when I've talked to the researcher that we collaborated with, she'd mentioned that so far, what was kind of considered gold standard was basically a survey with 6,000 responses that you'd normally just gather in one country, and here we had 140,000 from 180 countries, and we found out things that are kind of interesting and slightly surprising, maybe, that, for example, when people use dating apps, actually more people use them to look for a partner than to maybe look for a one-night stand. Or when people use apps to improve their relationship, actually men use apps to improve their relationship at a higher rate than women, and a bunch of other interesting results along those lines. Next slide. And so I'd like to use the last 56 seconds to actually kind of as a concluding note to say why this is important. So as a data scientist, I have like high interest in all of these topics, because for me, like from an intellectual point of view, that is very fascinating. Just kind of getting to see what model can we use, what data do we have, how do we engineer the features, what works, what doesn't work, and so that's extremely fascinating. But from kind of a personal perspective, I also think that this kind of work is very important, because one, in medical studies, in clinical trials, women have traditionally actually been excluded because kind of gender was considered to be just kind of an extra variable there. And on the other hand, in 2017, in large parts of the world, menstruation is still something that's considered taboo and shameful, even though it's a completely natural process. And so I feel that this kind of work, both getting our users to understand their cycle on kind of a daily basis, and also working to help move female health research forward, is helping normalize these conversations. Thank you.